One of the things that I've seen with clients who come with, especially with Najasat, Taharat, or religious OCDs, like whether it's to do with the ruzu or rakat or whatever, is that, like you said, if this person is asking you for the response and you don't give them what they want, they'll go to another one.
A lot of the times with these religious obsessions, they have these intrusive thoughts about the prophets or the
Yep.
Quran, the Ahlul Bayt, and it becomes so difficult for them to control it. It feels like the mind is bursting, basically.
Because it's that guilt and this pressure that, oh my god, how can I think of something so negative about a holy person, they try to stop it, but they fail, because the more you tell your mind not to do something, it ends up doing more, right?
Bismillah ar-Rahman ar-Rahim. Salamun alaikum, and thank you so much for joining us again for another podcast on mental health. This time we're going to take a different turn. We're going to look at something that is not properly discussed within our circles, yet it affects so many of us. That being OCD, Obsessive-Compulsive Disorder. Now, like I've been starting most of my podcasts with a hadith or a verse of the Quran, I'm going to start off this one as well. بسم الله الرحمن الرحيم فأقم وجهك للدين حنيفا فطرة الله فطر الناس عليها. The point here being that our fitra is based on the religion of Allah. Religion was never designed to be difficult. It was never supposed to be difficult. What has happened though is, because of different issues in our environment, different mental health issues, religion becomes so difficult to undertake. It becomes more like a burden rather than something that was supposed to make your life easier. And with that, we're joined again by our esteemed guest from Tehran, and expert in psychology, Sister Sabira Kanji. Thank you so much for joining me again.
You're welcome. It's a pleasure to be here.
So, OCD. My specialization is fiqh. I work in fiqh, so I get to meet people from all around. I get to talk to people from different parts of the world. And one thing I see is that people have this obsession with Taharat and Najasat. Yani, if Allah says wash once, they will wash 3. If Allah says wash 3, they'll wash 6. And it's like, they want to take one step ahead of Allah. What is OCD, and why is this obsession with Taharat and Najasat so much going on? It's like becoming more like it's becoming very common within our societies these days.
Yeah. So obsessive-compulsive disorder has two parts: the obsessions and the compulsions.
Okay.
Obsessions are the repetitive, uncontrollable thoughts that come in our mind. And compulsions are, because of those obsessions, you are compelled to do an act. It's more to do with the action, which is repetitive. So like you said, Najasat, Taharat is one of the most common ones. And even if I look at my own clients who have come with OCD, they're usually to do with Najasat and Taharat. So let's say if a person has an obsession that I'm not pak, I'm not clean enough, that is their obsession. So I have to clean myself again. That will be the compulsion. But sometimes obsessions and compulsions can take place on their own as well. Like, they can have just the obsessions and no compulsions. So, just the thoughts repetitively coming to their head.
So intrusive thoughts, basically.
Yeah, there's a slight difference, but they don't really act on those thoughts.
Okay.
And sometimes they're compulsions without any strong, repetitive, uncontrollable thoughts. But usually they come together: obsession, compulsion, disorder. And we have to also bear in mind that it's different from obsessive compulsive personality, which is a personality in which they're organized, they're clean, they're it's just a personality. It's not a disorder. A disorder becomes a disorder when it interferes with your life.
Yes.
It becomes a disorder when it is the timing and the intensity is quite high. So, sometimes this word of OCD is used very loosely. If the minute you find a person who, let's say, needs to have a particular blanket or a pillow cover, or they cannot bear things if they are not in order, they have to have their desk in a particular, and then we say, oh, you've got OCD. They might have a personality
say as well, like, oh, I'm OCD about my cleanliness, but it gets the word used so loosely that the real symptoms and the real disease itself then just gets buried under it all.
Yeah, because then when because obviously with Instagram and social media, mental health is something that is talked about very, even by people who are not experts, and they can use, oh, I have OCD, or these new terms, even narcissist personality. I see these days, the minute you have issues with your husband, you label them as
Narcissist.
narcissist.
Poor
And it's
guy.
become so
And
common.
misogynist.
Yeah,
They
so
use these words very nicely and
very,
loosely.
very easily, right? But they have a criteria. We've got a manual which is called DSM. We have to see, it fits that criteria, the duration, the intensity. I wanted to make this point clear because I see OCD being used, for people who might have just, a personality.
Yeah. So, what are the different types of OCD? Now, we've mentioned one of them, which is
Yeah.
Taharat Najasat, which affects a lot of people from the Muslim faith. What are the other types of it?
Yeah. So one of them is like what we call Taharat Najasat. It has to go. It has to do with sort of like fear of contamination or fear of not being clean enough,
Okay.
which will be the obsession, and the compulsion could be either doing wudu again, or doing ghusl, or cleaning, or washing, right? So it could be outside the religious paradigm as well. Like if a person has just got this fear of contamination, that I'm not clean enough, my hand is not clean, and they start washing 50 times, 100 times. So it could be not only just taharat and najasat, it could be just hand washing, or this fear of contamination. So the obsession is that I'm not clean enough, and the compulsion could be repeatedly washing your hands, or washing your environment. Like I've heard of people washing their walls, for instance, thinking that the wall is not clean, or washing eggs with Dettol, like
Oh,
with right. So it could be anything, that they are scared that it's not clean, it's contaminated. Another very common one is checking, right? So with checking, if it's to do with the compulsion is checking. So if they're repeatedly checking if the stove is
switched off.
switched off, or the doors are locked. And the fear behind the obsession behind that could be fear of, getting maybe, robbers coming in, if it's to do with the door, or, the house catching fire or something. These thoughts come in their mind that, oh, what if I've not closed the stove? And then what if my house gets on fire? What if this? What if? And then they go check again. And they go check again.
And like you say, they live in the future rather than the present, as
Yeah,
we
with
discussed in our
anxiety.
previous.
Yeah, with anxiety disorders, most of the thoughts are to do with the future. Others have obsessions about harming themselves or someone else.
Yes.
And if they act on that obsession and they are compulsive, they might self-harm, or they might harm others. It could also be just a compulsion without even, they sometimes tell you that, no, I didn't have a thought. I don't even know what happened. I just
did it.
Yeah. So again, self-harm. It also could be to do, like you said, intrusive thoughts. So it could be thoughts related to religion, related to taboo issues that keep coming in their mind, and then they might act on it, or they might not act on it.
A lot of the times with these religious obsessions, they have these intrusive thoughts about the prophets or the
Yeah.
Quran, the Ahlul Bayt, and it becomes so difficult for them to control it. It feels like the mind is bursting, basically.
Yeah. And with when it comes to religious, like, if God forbid, if they're having thoughts, let's say, about the prophet, that, something negative about the prophet. The thing is, they and then because they are Muslims and they have faith, and they start feeling guilty, and what they do is try to stop those thoughts, right? But the more you stop thoughts, like if I tell you, let's say, sister, don't think about a pink elephant, right?
And then you start thinking about the pink
Exactly.
elephant.
Maybe in your life you've never thought about a pink elephant, because elephants are grey. So, you will start thinking about it. And because it's that guilt and this pressure that, oh my God, how can I think of something so, negative about a holy person? They try to stop it, but they fail, because the more you tell your mind not to do something, it ends up doing more, right? So even in therapy, we work a lot on thoughts, right? So we tell them it is okay to have the thought, right? It is okay, it just comes, but then let it go, right? Let it pass like a cloud.
don't be very compulsive. Don't very obsess over that thought, basically.
Yeah, and because they have been doing it, like let's say if it's for a long period of time, they don't know how to just let the thought pass.
They don't know
Our
how to-
thoughts are not facts. Like I think I said it in my.
in our previous episodes.
It's such
yes.
an like the minute you start living on this, that our thoughts are just thoughts, right? And don't feed it or don't try to even stop it.
Just let it be.
Yeah, just let it be, let it come and go.
Before this podcast, we were discussing a bit about OCD when we were preparing. There was an interesting point you mentioned about the source of this OCD. Can we go over it again, just
Yeah.
for our viewers' sake?
Yeah, so no matter what the type of OCD is, like as a therapist, I would not really concentrate on what type is it or how many times. Yes, obviously I'll keep a record, but usually there is something behind it, right? So we kind of work on what has triggered those thoughts, what was going in your life when you started having these thoughts and compulsions. And we see that either it's a stressful period in their life or a period of their lives when they felt they were not in control.
Yes.
So OCD is to do with control. So let's say if I'm having difficulties in my relationships, or I'm going through some sort of exam stress or some kind of stress, and then somehow I feel that I'm not in control, right? So I'm not in control because of the stress. So cleaning my kitchen or organizing my table gives me some kind of control, and I feel good about it. Because with OCD, there's a cycle, right? So this thought comes in your head that you need to, let's say, organize this and it will look nice and whatever. And you get relief. You get this. So you get, first is like you feel anxious if you don't do it, but once you do it, it gives you this temporary relief, a good feeling, and you feel good. And then these thoughts come again, okay, do a little bit more of it. And then this client or this person does not realize that actually they are no more in control of that.
It's
The
now
OCD
controlling
is
them.
now, yeah. And that is when, they come for help, or they just go on and on and on until they realize they need help. Because, and usually when they come for help, it is because it's impacting their relationships, it's impacting their time, their energy, because people go from, like, let's say, spending hours and hours and hours in the washroom or the kitchen or the wherever or whatever kind of OCD they have. I've got a client whose mother would spend 14 to 16 hours in the washroom.
14 to 16. That's like
hours.
more than half a day.
And she would collapse.
Allah.
She would collapse because obviously, like,
14, 16 hours. That's
yeah.
like.
And this is her childhood memory.
And now she's stuck with that memory.
She had, obviously, it's trauma for the child.
It's a lot of, yeah.
I mean, like, she once told me that once as a child I had vomited, I had thrown up, and my mom, instead of, how a mother would say, "Are you okay?" she was like, "You have spoiled the carpet.
Now let's have it.
Go and clean it." So all the folk, because she couldn't take it, it was too much for the mother. But these are the memories she has from her childhood, right?
So the impact on
And the mother
surrounding.
didn't realize, because there's so much, they become preoccupied in their obsession, right? They don't realize it's impacting their relationships, it's impacting their parenting. The children become carers sometimes if the cases are really, we have cases where, the parents are preoccupied, or one of the parents is preoccupied with an OCD condition, and they just live with that. That is their life. That is their mental energy is just focused on that cleanliness or the checking or whatever it is. Even Najasat, or even with the namaz rakat, right? So even although we have rules of, namaz ihtiyat and all, but they're never satisfied, right?
Yes.
And they keep repeating and repeating. And unfortunately, there is no end unless they get some sort of help.
Now, coming from a fiqh background, having studied usul and fiqh, we discuss OCD while we're discussing fiqh and everything. And when it comes to Taharat and Najasat, there's one simple ruling we give in fiqh to anyone who comes with these issues. Ignore.
Yeah.
That's the first thing we tell them. If you become an obsessive doubter, the first and the final ruling for you is to ignore every doubt that comes from them. That's it. All responsibilities in fiqh are now uplifted from you. You have nothing to do with it. Even if you've washed it, You washed yourself once after going to the bathroom, that's it. Even if you think your whole body is najis, you have to exercise a willpower to now refrain from washing. I've had cases with people who they create these sort of circumstances or situations in their mind of najasat, taharat, or outside of najasat, like even other ahkam. Then they go through the whole book of laws, Islamic laws. Then they come out with a new ruling that has no relation to the actual problem. And I was kind of perplexed on how to deal with these people. So, I go to my teacher, I'm like, what do I do here now? She's like, tell them, it is forbidden for you to even look at the book of Islamic laws at this point. You need a rule. There's only one rule. You either have certainty or you have doubt. If you have doubt, there is nothing on you. That's it. Islam does not deal with doubt. Islam focuses on certainty. And the more you feed, even in fiqh, we tell anyone who comes to us with these issues, if you feed into your doubt, you're looking at an endless cycle. That's it. You're going downhill after this. So, you mentioned a few ways of how OCD impacts a person's life. Are there any other things we can work on, like other examples that people, at least in the Islamic world, deal with? Because obviously our viewers are primarily Muslims, so...
One of the things that I've seen with clients who come with, especially with Najasat, Taharat, or religious OCDs, like whether it's to do with the ruzu or rakat or whatever, is that, like you said, if this person is asking you for the response and you don't give them what they want, they'll go to another one. So they are actually, like, we have doctor shopping, this is actually scholar shopping. And why? Because they will never be satisfied until you give them what they want. So they'll go from therapist to therapist, from scholar to scholar, and look for this answer that is going to give them some kind of peace with it. But it's never going to happen, because OCD is a disorder which actually brings a lot of changes in your brain, right? Like if not treated earlier. And the more it gets severe, the harder it is to treat. And sometimes therapy alone does not work. We refer them for medication and therapy side by side, because the main mode for therapy is to work on the thoughts, right? CBT is the main mode of the one which is widely used and has been researched and is evidence-based. And there are others like exposure therapy and all. But the thing is, sometimes the client is not ready for that, right? And they do need medication as well.
So can you walk us through maybe a small example of how you would treat OCD? If you have an OCD patient, for example, someone who comes to you with an extreme case of, again, the whole Taharat Najasat, how would you kind of walk through with them?
So when it comes to Taharat and Najasat, the one thing that I've noticed is there's this deep fear of Allah, and it stems from the way they were introduced to Islam. You see, in our generations, there was this, especially I think in the previous generations, and now not so much, Allah was seen as this, someone to be feared of. And I'm not saying we should not fear Allah, but His love is much more than, like we start every surah with Bismillah ar-Rahman ar-Rahim, which shows His mercy, right? But they have got this fear that Allah is going to punish me if I'm not pak. Allah is going to be not accept my namaz. Allah is going to do this. What if I go to the fire? Whatever their thought patterns are. Again, the thoughts are to do with their thoughts of fear, right? This fear of upsetting Allah. This fear of Allah is going to punish me, right?
And this goes back all to tarbiyah.
It goes to
how we introduced Allah. In the hadith, we talk about hope and fear together, but it's like they completely kicked out hope and they gave fear to the kids.
Yeah, and it's the parenting style, isn't it? Like, they also have fear. Like, even parents wanted children to fear them. Like, mothers would say, or still say, that do this, otherwise I'll tell your dad. Like, this poor dad is someone who is kind and generous, now maybe, but because the mom keeps on repeating, like, if you don't do this, I'm going to call your dad, or if your dad comes and sees you like this, he's going to get upset. He might not. And then the mother also tells him, tells the dad that, show some kind of authority, right? So fear, we have been brought up, like, until and unless we think that there's no fear, we won't submit, right? And it's true for in the family environment as well as the way we see Allah, right? So these clients or these patients who are going through OCD literally cry and cry and cry in the sessions that, let's say if you're working through the thoughts and I tell them that, okay, your thoughts are not facts and just, let them pass and don't, like you said, it's just a doubt, leave it and don't act on it, right? So I just, in fact, a couple of weeks ago, I had a client who was crying and she's like, I just couldn't stop. I cleaned my whole washroom, then I cleaned the rug and this and that, and I got tired at the end. And still the whole day, so she didn't clean one part of it. She said the whole day I was just thinking of that one part is not clean, right? So it is, what I'm trying to say, it is such one of those difficult disorders, and the people who are inside them are, they know, one part of their mind tells them that, there's something wrong with you, but there's this other part which tells them, no, what if,
What if
your
my
namaz is not.
doubt is reality?
Yeah, exactly. They said that, it's, what if it is real? What if there was a drop and I didn't clean it? And now, my namaz is
really
not valid, my iman is not, all these thoughts follow through,
So
right?
all that good fine line between reality and this doubt is completely
It's
messed up
distorted.
for them.
Yeah,
It's
it's
distorted, for them.
distorted, completely
And it
distorted.
goes back to the fact that we've instilled so much fear of Allah into our children's hearts,
It could be one of
One
the
of
reasons. Yeah, I've seen it
rather
quite.
than
Yeah.
actually focusing on hope of Allah. Where, like in one of our previous episodes, we talked about لا تقنطوا من رحمة الله. Do not despair of Allah's mercy.
Yeah.
Do not despair of Allah's mercy. And yet we teach our kids, we don't teach them the mercy and the hope and the love of Allah, but we teach them fear in order to bring them in line, where this is more detrimental to them than anything else. That is a very interesting way to look at it. And given that we've discussed a bit about these things, what is your advice to anyone struggling with OCD? Just a simple advice you can give them.
When it comes to OCD, before the person who is going through OCD, people around start noticing, right? Because it's impacting their relationships. Imagine a wife who has a cleanliness OCD and she spends cleaning the kitchen 2 hours after, 3 hours after dinner time. And the husband is obviously waiting for her, or he wants to spend time with her, and she doesn't realize, because even if she comes and sits with him, her mind will be that, oh, that cabinet is not clean, or my worktop is still got that one stain, right? So people around them get affected, and when they try to convince them, they have this, no, I have to do it. It's like a pull, right? This OCD just because instead of focusing on the present, right? Instead of having a good time with their family members, with their children, with their spouse, with their, even if it's friends, whatever, their life revolves around their obsession, right? So even if let's say a young person is going out with their friends, they'll be, oh my God, my kitchen needs to be clean, or I have not checked my stove. What if this has happened? What if, they cannot enjoy their lives, right? But they're so much preoccupied that they might not realize. So the first thing is get help as, in the earlier stages. Okay. Before it destroys your relationships, it destroys your everything, your mood, your sleep, your life, your energy, because you're spending so much time doing, let's say if you're cleaning, when we clean our house, it takes energy, right? And these people are doing it again and again for every day. People get skin problems because of washing their hands so many times. Yeah. People have a OCD for brushing teeth. Their gums start bleeding. Okay. So there's many types. So it's about realizing and getting help as soon as possible.
Thank you very much. And I
You're
think
welcome.
with this we can call it a wrap. And thank you so much for joining us on this episode on OCD. If this has been of any help to you, and if you've seen yourself struggling with any of these issues, please reach out to your nearest therapist, doctor, get some help. Even if you have a respected scholar within your communities, ask them to help you out. And inshallah, we can get a hang on this not so nice disease. And with that, thank you so much for joining us once again. And please hit the like button on our videos, subscribe, and hit the bell notification so that you will be notified every time we release a new video. Thank you so much.